We've all been there. You're enjoying a meal, savoring every bite, and suddenly, your diaphragm decides to have a mind of its own. You're in the middle of a delightful conversation, perhaps sharing a laugh with friends, and out of nowhere, you feel that unmistakable twitch. Hiccups. Those involuntary, often embarrassing spasms that interrupt conversations and leave us gasping for air. They can be quite the nuisance, can't they? But have you ever stopped to wonder why we hiccup? What triggers these sudden, uncontrollable contractions of the diaphragm? What's the science behind this strange bodily function? The diaphragm, a dome-shaped muscle at the base of our lungs, plays a crucial role in breathing. Hiccups, those peculiar interruptions in our breathing, are a universal human experience. They don't discriminate. They affect people of all ages, from newborns to the elderly. From the moment we're born to our twilight years, hiccups can strike anyone, anywhere, at any time. They can occur during a meal, a conversation, or even in the middle of the night. But despite their ubiquity, the science behind these involuntary spasms remains somewhat of a mystery. Researchers have been studying hiccups for years, yet many questions remain unanswered. Join me on a journey as we delve into the fascinating world of hiccups, exploring their causes, remedies, and the latest scientific insights. We'll look at the various theories that scientists have proposed over the years. We'll uncover the intricate interplay of nerves, muscles, and the brain that gives rise to these peculiar sounds. The vagus nerve, the phrenic nerve, and the brainstem all play a part in this complex process. And who knows, we might even discover a new trick or two to quiet those pesky hicks. From holding your breath to drinking water upside down, we'll explore the most popular and bizarre remedies people swear by. At the heart of every hiccup lies the diaphragm, a dome-shaped muscle situated at the base of our lungs. This muscle plays a crucial role in our respiratory system, acting as a partition between the thoracic cavity, which houses the heart and lungs, and the abdominal cavity, which contains the digestive organs. This tireless worker is responsible for regulating our breathing. It contracts and flattens when we inhale, creating a vacuum that allows air to flow into our lungs. This process is essential for oxygenating our blood and removing carbon dioxide. When we inhale, the diaphragm contracts, pulling downward and creating space for our lungs to expand. This downward movement increases the volume of the thoracic cavity, reducing the pressure inside and drawing air into the lungs. When we exhale, it relaxes, pushing air back out. The diaphragm moves upward, decreasing the volume of the thoracic cavity and increasing the pressure, which forces air out of the lungs. Hiccups occur when this normally well-coordinated dance goes awry. Various factors such as eating too quickly, consuming carbonated beverages, or sudden excitement can trigger this disruption. The diaphragm experiences a sudden involuntary spasm, causing a rapid intake of breath. This spasm is often brief but can be repetitive, leading to a series of hiccups. This abrupt inhalation is quickly followed by the closure of the glottis, the opening between the vocal cords, producing the characteristic hic sound. The glottis acts as a valve, and its sudden closure creates the distinctive noise. Imagine a drum being struck. That's akin to what happens when your glottis snaps shut during a hiccup. The sudden closure creates a sharp sound, much like the beat of a drum. The sound is a byproduct of the sudden pressure change caused by the rapid closure of this airway. This pressure change is what makes the hiccup sound so abrupt and noticeable. While the exact triggers for hiccups remain elusive, several culprits have been identified. Eating or drinking too quickly, consuming spicy foods, carbonated beverages, and even excitement or stress can set off a bout of hiccups. In essence, anything that irritates the diaphragm or disrupts its rhythm can trigger these involuntary spasms. Think of your diaphragm as a sensitive musician trying to maintain a steady beat. When bombarded by a cacophony of stimuli, a rush of spicy chili, a sudden gulp of soda, a wave of nervous laughter, it can lose its rhythm, resulting in a series of hiccups. Other potential irritants include a distended stomach, which can press against the diaphragm, and sudden temperature changes like gulping down an ice-cold drink. Over the centuries, countless home remedies have emerged, each claiming to cure the hiccups. While their effectiveness varies, these remedies often focus on disrupting the hiccup cycle by stimulating the vagus nerve, a long nerve that runs from the brain to the abdomen and plays a role in regulating many bodily functions, including breathing. Some popular remedies include holding your breath. This increases carbon dioxide levels in the blood, which can help relax the diaphragm. Sipping cold water. The cold temperature can stimulate the vagus nerve. Swallowing a teaspoon of sugar. The grainy texture is thought to stimulate the vagus nerve. Biting on a lemon. The sour taste can stimulate saliva production, which may help stop hiccups. Remember, these remedies are often based on anecdotal evidence, and their effectiveness may vary from person to person. Section 5. When hiccups linger. Persistent hiccups and underlying causes. In this section we will delve into the reasons why hiccups sometimes don't go away, and what it could mean for your health. While most hiccup episodes are short-lived and harmless, lasting only a few minutes, some can persist for hours or even days. These prolonged episodes can be quite uncomfortable and may interfere with daily activities, making it difficult to eat, sleep, or even speak.
These persistent hiccups, scientifically known as intractable hiccups, can be a sign of an underlying medical condition. Intractable hiccups are defined as hiccups that last for more than 48 hours and can sometimes continue for months or even years if not properly treated.
Conditions that can cause persistent hiccups include gastrointestinal disorders, central nervous system disorders, metabolic disorders, and certain medications. Each of these conditions can affect the body in different ways, leading to the irritation or malfunction of the diaphragm, which is the muscle responsible for hiccuping.
Gastrointestinal disorders like GERD, gastritis, or peptic ulcers can irritate the diaphragm. These conditions cause inflammation or irritation in the digestive tract, which can then trigger the nerves that control the diaphragm, leading to persistent hiccups.
Central nervous system disorders, such as stroke, brain tumors, or meningitis, can affect the nerves that control the diaphragm. When these nerves are damaged or disrupted, it can result in continuous hiccuping that is difficult to control.
Metabolic disorders, including diabetes, kidney disease, or electrolyte imbalances, can disrupt the body's normal functions, including breathing. These disruptions can lead to persistent hiccups as the body's systems struggle to maintain balance.
Certain medications, like corticosteroids or benzodiazepines, can have hiccups as a side effect. These medications can affect the central nervous system or the gastrointestinal tract, leading to prolonged episodes of hiccups.
If your hiccups last for more than 48 hours, it's crucial to seek medical attention to rule out any serious underlying causes. Persistent hiccups can be more than just a nuisance. They can be a sign that something more serious is going on in your body. Early diagnosis and treatment are key to managing the underlying condition and alleviating the hiccups. Section 6. Preventive measures keeping hiccups at bay. While we can't always predict when a bout of hiccups might strike, certain lifestyle modifications can help reduce their frequency. Mindful eating. Eating slowly and in a relaxed environment can help prevent air swallowing, a common hiccup trigger. Avoiding trigger foods. Limiting your intake of spicy foods, carbonated drinks, and alcohol can also help keep hiccups at bay. Managing stress. Stress is a known hiccup trigger, so practicing stress-reducing techniques like deep breathing exercises, yoga, or meditation can be beneficial. By making simple changes to your daily routine, you can minimize the chances of those pesky hiccups interrupting your day. Section 7. Exploring the science, a deeper dive into hiccup research. Despite centuries of fascination, the exact purpose of hiccups remains a mystery. Some scientists believe hiccups are a vestigial reflex from our evolutionary past, possibly a remnant of the gill-breathing mechanism in amphibians. Others speculate they might play a role in regulating breathing in infants. However, much remains unknown about these involuntary spasms. Researchers continue to explore the neural pathways, neurotransmitters, and potential genetic factors involved in hiccups. Advanced imaging techniques, such as fMRI, are allowing scientists to visualize brain activity during hiccup episodes, providing valuable insights into the neural mechanisms at play. Section 8. Conclusion. Hiccups, a minor inconvenience with a fascinating story. Hiccups, though often a source of amusement or annoyance, offer a glimpse into the complex and often quirky workings of our bodies. While their exact purpose remains elusive, understanding their causes, triggers, and potential remedies empowers us to better manage these involuntary spasms. So the next time you find yourself in the throes of a hiccup fit, take a moment to appreciate the intricate interplay of nerves, muscles, and the brain that gives rise to this peculiar phenomenon. It's a reminder that even the most mundane bodily functions have a fascinating story to tell. Section 9. Call to action. Share the hiccup wisdom. Did you find this exploration of hiccups enlightening? Share this newfound knowledge with your friends and family and help them unravel the mysteries of these curious spasms. And don't forget to subscribe for more fascinating insights into the wonders of science and the human body.